Why did we start this? So that we could provide better care to the patients and better outcomes. Figuring out what's wrong with the patient, fixing it, and changing their life and getting them back to what they love to do.
What sets us aside from everybody else, having everything under one roof, having world-class physical therapists, fellowship-trained spine surgeons, and non-surgical spine care, including myself. So patients can come in, they can get their therapy, they get their injection therapy, and it can meet a surgeon as indicated without having to be shuffled around the community. So for us, the Spine Center sets us apart.
To diagnose and treat spine-related problems with a conservative approach, with a complete approach including injections, therapy, rehabilitative efforts, and surgery, and any kind of spine-related problem, whether it's my back's been hurting for 3 days or I have scoliosis that's been worsening over many, many years. The fact that we have all of these tools available to our patients is, I think, the most important part of how Spine Austin works.
We take care of everything from a simple degenerative disc disease or a disc herniation in the cervical or lumbar spine to things as complex as revision, spinal deformity, kyphoscoliosis. Most spinal disorders can be significantly improved without needing to have surgery. We really reserve surgery as the last option to try to improve someone's symptoms if the conservative treatments have failed.
From a multidisciplinary spine center standpoint, conservative care means, in general, non-surgical care.
Our premise or our mission is to help people by first implementing non-surgical means. All the doctors here, all the physicians here at Spine Austin really go into the room with that same idea that if there is a way to restore function, alleviate pain without surgical means, that's the way to do it. But with, again, the notion that we have some great surgeons, some of the best surgeons around to serve that purpose.
We also have a surgical side to our practice with spine surgeons who cover the gamut of spinal disorders, including spinal deformity, both cervical, thoracic, and lumbar spine disease, degenerative conditions, as well as pediatric and adult spinal disorder.
The surgeons here are all trained in spinal deformity work. Scoliosis is the most obvious one. And I think, and I've always thought this, that if you can do the hard surgeries, the easy surgeries are easy.
There is a role for pain management. There is a subspecialty called pain management. It's usually anesthesia-based. For us, that's not what we're trying to do. We're trying to find the problem and correct it from a non-surgical or surgical standpoint. Instead of being pain management, our goal is pain resolution.